On average in the UK, it takes 9.5 years to get diagnosed with bipolar disorder. Even if one person listens to this and decides to take the plunge and go for it, I'd be very happy.
Edwin, I'm so excited to have you today because you're building something really, really, really cool. And I'd love you to share with us a bit about what you're doing.
Where do I start? I think the simplest way to put this is that I'm building Psyrin with two other co-founders, Raheem and Julie. What we're building are digital biomarkers of mental illness. Are you familiar with that concept or construct?
I'm not familiar. Tell me more.
Right. So when we say biomarker, we mean signals from the body or mind that can help identify and monitor these mental illnesses over time. Right.
Brilliant. So my understanding of what you do, your technology can use voice to hear different mental illnesses people may have.
That's probably a better summary than what I gave, honestly. But our first sort of protocol is voice. But there's a very natural reason for that. It's just what we think is the best, most obvious biomarker to use.
It's crazy.
Right? Yeah, I know people talk about face, passive sensing, like, how much you sleep, how much you walk, things like that. But voice just seemed to be a very nice sort of merge between the biological elements of mental health, but also the sort of psychosocial elements of mental health. They kind of converge on this signal within that voice, right? That's why we picked it.
So what is being used now to detect mental illness? Because it's not a voice, is it? Like, I can't go to the doctors and they'll be like, from your voice, I can tell you got this, this and that. Like,
well, funnily enough, I mean, the roots of our technology lie within actual clinical practice. So doctors are somewhat trained to listen for things in the way their patients speak, right? Psychiatrists, psychologists, they're all taught that there are signs of distress in your voice. You can find different kind of things within the voice patterns. So it's not too unfamiliar to our clinicians that we speak with. We think that a key bottleneck within the mental health care system lies within the inability to accurately, objectively, repeatedly, quickly detect, monitor, match people to the right treatment, etc.
Brilliant, brilliant. So could you just explain to us a bit more about your technology? Like, what's the first phase looking like, especially with using voice to recognize mental illness?
Yeah, so I mean, I think we can break it down very simply on two fronts without giving too much away. Right? We basically look at both the things you say, like language, right? Linguistics, but also how you say it in terms of the acoustics in your voice itself, right? When I say language, it's not like I'm going to say, hey, I'm sad. Okay, you're depressed. That's not how our algorithm works.
Yeah,
no.
That what
Basically, what we do is we look at a bunch of linguistic patterns, really.
Right.
This is stuff that my co-founder Julie did in her PhD, or learned to do in her PhD, rather, I'd say. We got inspired by that work, basically, and put that into our own pipeline. She made a few new features, that's what we call features, right? You combine that with our set of acoustic features, meaning like how you say things, the voice, the variability in tone, for example. Then you have a set of maybe 200, 300 different features that can help inform how people, feel.
So is the tone, and did you say the pattern?
Yeah, I mean, we can get into the weeds of that, but that stuff is proprietary.
So different, like if you've got depression, you will have a different, is it like rhythm pattern of speaking?
I'd say there are different signatures, really. But our main focus and our love as a company is with serious mental illness. So things like schizophrenia, bipolar, right? Now, these are conditions that have specifically high relationships, I guess, to voices, right? The best way I can illustrate this is with the construct of schizophrenia, right? You have something what you call thought disorder underlying schizophrenia. As the name suggests, just like disorganizations in your thought, right? Now, that is directly reflected in the way you string together sentences. The later it is, the more obvious it is. But the point is we can pick it up earlier, right?
Okay, that's the key.
That's exactly the key, right? So we can use the AI to have high resolution on those subtle signs, so we can try to intervene early. And that's really the goal, right? Can we, again, the concept of biomarker, can we predict what's going to happen early and then allow for changes in the way we handle things?
Brilliant. Let's say someone has bipolar disorder.
Right.
When are they usually diagnosed, and when do you think it can now diagnose them?
On average in the UK, it takes 9.5 years to get diagnosed with bipolar disorder.
9.5 years.
Now, within that statistic is a couple different factors, right? It's not just you wait 9.5 years, right? You may be waiting months, realistically. Like it takes months. There's wait lists, but more importantly, there's things like misdiagnoses, where people who have bipolar actually get diagnosed with depression first, like unipolar depression, right?
And what's the reason for that? Is it because
the presentation of the symptoms are very similar, right? You have a depressive phase of bipolar disorder as well, right? It's bipolar depression almost, right? So because of that, oftentimes presentation looks the same and the doctors aren't able to tell exactly what the difference is. So they give the wrong diagnosis and perhaps prescribe the wrong treatment, right? So that misdiagnosis means that people don't really get better. They could even get worse, right? And that leads to that 9.5 year timeline, right? So I mean, the dream is like, can we, again, with the concept of a biomarker, identify what someone has before a doctor can, basically. Before they go and develop bipolar, can we see, oh, this person's on a trajectory to have an episode?
So that's really interesting. What strikes me is that, let's say this person doesn't know they have bipolar. So how would they then come to the doctor with an issue? Like, how would you be able to test them if they're not even coming to you with an issue?
Well, the point is there is an issue. It's just unclear what that is, right?
Oh, so they have an, okay.
They'll be sad, or they'll feel a bit lack of energy. There'll be some anhedonia or something like that, right? So they'll come and see someone, or they'll realize they need help.
But you just can't detect as bipolar.
Or you just can't, exactly.
Right. That's phenomenal.
It's just one example.
Phenomenal. Share more. I would love, drink some bubble tea and let's hear some more examples. Like, I'm actually so fascinated by this.
I mean, I think one cool concept is with the idea of early intervention in schizophrenia. Started maybe 20 years ago in the UK, really. It's been a thing in the US for about the same time now. The construct is the earlier intervene after someone has their first episode of psychosis. Are you familiar with psychosis? Psychosis is basically an umbrella term to describe like a cluster of symptoms, things like delusions, hallucinations. Basically, the first episode is when you have that first episode of these symptoms happening, right? So oftentimes it ends up hospitalizing somebody. So the point is, there's been a movement in the last 10 years to see if we can pick up on people who are at risk of that first episode. But the way we do that isn't great right now. We use questionnaires, we ask about an hour and a half worth of questions, right? We rely on a lot of subjective judgment from both the clinician and the patient themselves, right? So it's not the most effective. And one of the studies that we're doing right now is to try to map whether we can predict which people who are at risk actually develop a first episode of psychosis. And again, the concept is if we can identify and stratify that risk properly, in principle, you can intervene earlier and prevent all the costs associated with an actual episode of psychosis.
That's brilliant. What impact do you want your technology to have?
I think it's something that I called back to in the first part of what I said. It's looking at whether we can downstream change care pathways. What does that mean? Can we change the way that people fundamentally think of and interact with the construct of mental health? I think we've had a lot of progress because of good advocacy to think about mental health broadly, but I'd still argue that access is confusing and a bit of a mess, right? And our big thing is we think a big fundamental flaw there is the lack of not just education, but lack of strong objective technology. Hence our focus on developing this out, right? We believe if we can get this working, we can fundamentally change how people approach help, right? Instead of waiting for 6 months for something, can you have a first signal with a test that we do, right? Instead of getting prescribed a drug based on trial and error, can you like match someone to the right antidepressant, for example? Right? So obviously this is big picture stuff. It's a vision down the line. And how that becomes brought into reality is still not 100% clear. It never is. But I think we have a few feelings and hints about what that
looks like. You mentioned a key point that I really want to touch on. You mentioned access. How are these clinicians accessing your technology? What does that look like for them? Do they have an app?
Yeah, so right now we've basically developed a web app. So a fancy word for website, basically, right? In terms of, as far as they see, there's a website that they go to, right? They log into the system and they get to see the patients having done our task, right? Now, it's not yet a medical device. It's not regulated. It's not approved or anything. It's not used for diagnoses. But under research agreements that we're running right now, they have access to this tool in a research context, right? So they can start to see the potential of the AI even now. And with their help and their labels, we can sort of improve on the algorithms over time.
That's brilliant. And so the next stage of the podcast, I want to get into knowing you a bit more, why you started this. Like, I'm not sure if you've seen the Stephen Bartlett podcast, but he says that there's a lot to tell about someone and the things they pursue based on how they were as a child. I was going to ask, what was child Edwin like? Did he know he would be pioneering such an innovative technology in the mental health space?
So it's funny you mentioned this. I had a bit of a debate with one of my founder friends the other day. He was hiring at the time, and he was saying that one of his biggest criteria is trying to find an agency as a child. And
agency?
Like this initiative, this drive to do things, what you just asked, basically. And just like Stephen Bartlett said, something that you can tell of a good entrepreneur. And I was asked this in a few pitches too. To answer your question, frankly, I think that there were things I did as a child that weren't status quo. A lot of it was because I had aspirational or ambitious parents. So I think they put a lot of things on me that made me kind of stand out the crowd. For example, I used to play chess. It's not something I wanted to do voluntarily, but they made me do that. And I think I'm very grateful now, looking back, that they made me do these things. Obviously, as a kid, you're a bit, reticent to do practice, repetition. But in retrospect, I think it worked out well. And it gave me a lot of exposure to different experiences that creates this sort of conviction frame of thought, I think.
So you would attribute like having a conviction frame of thought to what you do now. So it's less about what you were actually going to pursue, but more about the way you pursue.
Yeah, I mean, I can't say that at 10 years old I knew that mental health was my future, right?
Who does?
I think I started university in Singapore looking at life sciences. That just fancy word from biomed, right, in Singapore. And I always knew the brain was the one. Like it was just much more interesting than anything in biology to me, right? Like there was it links with psychology, philosophy, and it brings that into some sort of real manifestation, right? Now, I mean, even then though, I wasn't clear that mental health was the one. It's just something to do with the brain. And as I explored different research projects, different industry projects, different startup ideas, eventually, it became clear that this was a space I wanted to make an impact in. It's something that I really deeply cared about on a personal level. It links with some of my core philosophies as a human. So it just made a lot of sense to kind of get in here. And now I'm always thinking, is this what I want to do? And the answer up till now has always been, yeah, this is pretty much exactly what I would want to do in my life.
Brilliant. And you are currently studying a PhD. So you were studying at the National University of Singapore. And now you're doing
the joint PhD, basically. So I'm affiliated with both still the National University of Singapore in US and King's in London. I submitted my thesis a couple months ago, though, so I don't know if I'm still doing it. I have to defend the thesis still, but I think by the time this comes out, it will be. Hopefully, I'm Dr. Wong.
Oh, Wow, Dr. Wong, welcome to the podcast.
Thank you very much.
That's brilliant. So what's your PhD on?
Right. Somewhat similar, but a little different, I guess. We look at, can I take a picture of your genetic makeup and see whether that links to how likely you are to be depressed?
It's crazy.
Or how likely you are to respond to this treatment. It's the same core philosophies, right? Identification and response to like treatment more effectively through a genetic lens initially. And I mean, I'm very bullish on that field in particular, but I think it does, you kind of lose out on some of the psychosocial elements that mold someone's mental health, which is why in our startup,
you want to use the voice.
Exactly.
So if you could explain to us your co-founder's PhD too, because how did those two marry? You two have both got such very specific...
Yeah, I don't know if they marry. I mean, her PhD work was, in my opinion, far more impressive, to be very frank, right? Basically, when we met, because of the intersection in our topics and the fact that we were in the same building, there was a very easy, natural connection built.
Nice.
I can't say we came into it thinking this is going to be the startup.
Yeah.
But I remember distinctly the first time I met her and she told me about her PhD, my first thought was, damn, that's cool. She convinced me.
Yeah.
She showed me the math. She showed me the papers. I was like, that's great. And my third co-founder, Raheem, same thing with him. Like when he first met us, he was skeptical as hell. He was like, well, nah, this
I was
can't
like, you're using voice to diagnose mental... I was like, impossible.
But yeah, I mean, you know, we're not all the way there yet, but I think we're on a good path.
Yeah, brilliant. And actually, I'd love to delve into how you guys met, how you guys knew to build something together. Like, how did that come about?
Yeah, I mean, that's interesting. I think, you know, we had a chance to trial the whole thing in something called Idea Factory at King's, right? Nice. So King's host this idea competition every year.
Shout out King's.
They're going to love you for that one.
Yeah.
But basically, it was a good test run. We made the pitch deck together. We were recording videos together, ended up pitching together, right? I think it gave us a good sort of simulation, going through deadlines, having some pressure. There was some turmoil, right? I remember like Julie missed her flight or something. So like there's always something.
There's always
right?
something.
But you learn to figure it out. You learn if you guys work together well as a team, right? But yeah, I mean, that's kind of how we tested the thing. I think it took us a few months to get in the groove, you know, having three people as co-founders, there's three different personalities. We're all very different as well, right? So
you're the CEO.
Indeed. Julie's our CTO. And Raheem's our COO. But I mean, again, these labels at this stage are very fluid, I would say. By and large, I handle most of the public commercial stuff. Julie handles the science and tech. Raheem handles anything regulations, medical implementation-wise, because of his background as a doctor.
So you all came together. Then how did you guys, what was that moment that you were like, yeah, let's work together. Let's make this a thing?
I don't know if there was a singular moment. I think, you know, literally, we signed a founder's agreement that I drew up myself on the template. Yeah, at that time we had no money, right? So I didn't want to buy anything. So I Frankensteined a few things together and I took some inspiration from friends basically and made a founder's agreement. Now, that exact date was like, I don't know, maybe 2 months ago now at this point. But we didn't seriously start working on it, I think, until like August. And that was after a round of validation.
Yeah.
So, I mean, every startup person will talk about validation. It's important. I think the extent of its importance is debatable. I think that sometimes if you have a vision of the world, you don't necessarily need constant validation. This is a whole other conversation. But
honestly, let's expand on this.
I mean, it's just...
You can drink your tea because we're spilling the tea right now. Yeah. Because everyone says it's so important to validate. Now you're saying, maybe it's overrated. Like, let us know your thoughts on that.
I think you still need to build things that people want, right? User experiences are essential. How people react to the product is essential. I do think that depending on your type of business, you have different strategies, right? Now, for something like ours, where we have, you know, it's a healthcare company, but it's really a deep tech play, right? We're talking about doing things that are incredibly futuristic, right? Predicting how people respond to drugs on a biomarker alone. I think now we're at a time where you can actually do it.
Yeah.
It takes time. Exactly. And that means that because of that lead time, the validation won't be as clear. People wouldn't be able to imagine the construct of touchscreen until they see it and use it. You could have asked someone, but you wouldn't know the truth of whether the touchscreen would work until they engage with it.
So when you're talking about validation, you're talking about validation that the technology would work.
I'm talking about validation that users want it.
That users want it. But
technological validation is important, especially for a company like ours that's tech first. Like, you need validation on that side.
But I guess it would be validating that if you ask someone, would they want to be diagnosed more accurately? People would be like, yeah.
To some extent, I think more specifically in our case is speaking with clinicians. So what we did was speak with clinicians, psychologists, psychiatrists, nurses, etc. Told them about the construct of it and asked for their feedback, or their reaction, right? And I mean, we did spend quite a bit of time, weeks doing this because this is what the incubators, accelerators taught us to do. It was useful. Insightful.
Yeah.
But at the same time, I think you need to have confidence in the way you see the world to some extent, right? I mean, especially at this time, 2 years ago, ChatGPT wasn't as rife as it was, right? So there was more skepticism, right? And there was a lot of, I guess, scientific doubt.
Yeah.
Because you don't have an hour and a half to explain the science behind it. So yeah, my point is just, there's a bunch of advice. There's always advice again and again, and there's different startup adages, and a lot of them have value and truth. But I think the problem with advice is that it oftentimes tends to be general or generalized, right? So I encourage people listening to, kind of focus on the way they think. Or it's an overused word, I think, first principles thinking. It's a little bit cliche to say that.
What is first principles thinking?
It's like, thinking about a problem from its fundamentals, like breaking it down into its roots and then try to think from there, basically, right? It's a fancy term, but really it just means like try to think for yourself freely and understand what is an opinion molded by others versus molded by yourself.
So the next section of the podcast, we're going to really delve into the specifics of building a MedTech startup. What are some of the challenges you found building a MedTech startup?
It's tough because there are so many challenges. What I would say are that the biggest challenges we've faced so far are not necessarily isolated to MedTech as a construct. I think there's a lot about building a startup that you won't understand or empathize with until you do it. That's not groundbreaking. People know this. But still, every time people come up to me for advice or things, I was like, how did you start this? Like, what did you do? And like, the truth is, like, you just got to go. You just got to go, right? Because only then will you experience all these challenges and hardships that people want me to talk about on things like this, right? Like, I can lay them out right now, each one by one, which I can do for you, but people won't feel it or understand it until they do. I mean, you yourself as a founder, you felt it finally, right? It's one thing to say that, for example, it's tough to get rejected. I can tell people this is a big challenge, right?
But
rejection. Until you experience it again, people doubting you all the time. You don't understand what it feels like. Exactly.
And how to still be convicted when like so many people keep telling you no. What sort of rejections have you faced that you're like,
You mean in my personal life or professional life?
Honestly, tell us everything.
This is good. We're changing direction here in the podcast, aren't we?
Tell it like both. Yeah.
I mean, I feel on all fronts, right? I think, in my personal life, there's small things, right? There's rejection of not bullying, but like a form of bullying is rejection. It makes you feel rejected. I mean, there was a few teasing here and there going on, but nothing that serious. I think the biggest rejection is probably the first time I had rejection was university applications, right? Yeah. I applied to Stanford, Caltech, and Harvard, and all three said no. Surprise, surprise.
No, but still, it's tough, yeah.
As far as a startup's concerned, I mean, rejections all the time, right? Even in this validation phase, right? We maybe spoke with 10 or 12 people a week, right? And it wouldn't be rejection, but you'd have people shooting down ideas, right? Which is not bad. I think it helped us narrow down exactly what we want to do. We started with a very broad thing, like, all right, we have this idea of speech for mental health. What do you need, right? So we're able to whittle things down because of the rejection. But some of the more harsh ones are investor rejections, right? That's going to happen.
Yeah.
Some investors will say no, right?
What are they? Why are they saying no to you? Some of them
I mean, for a variety of reasons. I think honestly, sometimes it's not a good fit, right? Like it's as much your choice of who you want to work with as their choice to invest in you sometimes, right? I mean, we're very fortunate to have some phenomenal investors on our team right now. Yeah. They understand what we're balancing because of a long-term deep vision, but also trying to, change the perception of mental health right now, right? It's a bit of a dissonance almost, but
get it,
And it took time to find the investors that got it. Naturally, you're going to find rejection, right? There are a few funds that didn't give you time of day. They speak to you for half an hour, you give a generic response, and you get a generic rejection email, right? That's going to happen. It's going to happen, right? Which is okay, right? It just wasn't a fit. There doesn't have to be beef there. I can't say it doesn't motivate me to prove them wrong.
Yeah, it does. I'm sure you can add them to your investor updates and say it's going really well.
So lots of rejection, I think, generally.
And what tips do you have for entrepreneurs who, because you've got pre-seed funding now, what did you do to get that? Any tips you could share to find the right fit investors?
I mean, I think it's easy to start with grants, actually. I know it's doesn't answer your question directly, but I'd imagine, we started with a grant. Right? Our first thing was a grant. It was Innovate UK Fast Start.
Nice.
Right? Which was great.
We'll tag that below.
I mean, it's open to people, and they gave it to us while we were students. Even. They just believed in the technology. We were experts, but even while we're doing our PhD, we were able to get that grant and kick things off. And that, I think, in my mind, was the true start of Psyrin. That's when we were like, okay, it's not just an idea. We have the funds, but let's make something happen. And that was our first time collecting data, doing things for real, right? So I encourage looking at the grant opportunities out there. And again, people can get bogged down by fear. Oh, I'm too young, I'm too inexperienced, blah, blah. Might as well try. It doesn't cost much. It's literally free.
Just take some time to fill them out.
And especially if you're in the UK, I think there's some fantastic opportunities in-house. My biggest piece of advice is if you have a strong idea, some strong background, get a grant writer to help you out. I think it depends on who you want. I mean, if anyone's listening to this and they want somebody, they can just hit me up. I know a couple of really good ones who really helped us kind of walk through the process without losing the integrity of what we're trying to build. Exactly.
And I love that you've mentioned that, because that's such a key insight, because these grants are quite hard to get if you don't know how to write them.
Indeed. And you've got grant writing companies, right? But in my experience, those are not as good as those
finding a right,
just individual people who kind of consult here and there. And those guys are the key.
And probably more affordable.
Indeed. I mean, oftentimes they can work on a post basis, right? Well, the majority of their, payment comes after you get the grant, right? If you can, but again, your idea has to be good.
Yeah.
So this is where you'll get some first validation from the grant writer themselves. They'll tell you if it fits the grant theme.
Brilliant. And I really wanted to talk about your go-to market strategy, because I know that's changed a lot. you know, you initially trying to pilot in the NHS, but now you have a different strategy. Sort of take us through all of that.
Yeah, I mean, without giving too much away, given what we're exploring, probably the biggest shift in our go-to-market is geography almost, right? You alluded to this earlier, but we've moved away from the UK and the NHS as a focus to the United States as a focus. Yeah. We want to come back to the UK, the NHS, and get things done here. But given the stage of company we are, given who we are as people and what we can do, it just didn't seem like the most conducive way to build the company that we want to build, to enact the vision that we want to enact, right?
And what's that reason?
A combination of factors, to be honest. The NHS is I think it gets a lot of flack unfairly, right? It's a fantastic system to have, you know, some form of socialized care, right? But, you know, there is a trade-off in that, right? They're overworked. There's not enough staff. There's not enough money, frankly, right? And understanding how to operate in the NHS without having, number one, sold to the NHS before, number two, worked in the NHS. Well, I mean, I guess Raheem did technically, but it just was really a foreign experience, right? The number of stakeholders required to buy in to get things through the door is monumental.
Really?
It's large. I mean, you got to speak to the right people and get your ducks in order again and again and again, right? Timing has to be excellent. You know, I got a friend who may be lodging in a hospital, right? It's because they're building the hospital. It's good timing because now you can come in, right? There's opportunity versus established. You get what I mean, right?
Okay, cool.
Right? But yeah, I think some of it also is a cultural difference generally in optimism versus pessimism / skepticism. Yeah. Really. So, and again, this is just my experience so far, but you get a lot more excitement and vibrancy when speaking with professionals in the States about the potential of this technology versus when you speak about it here, where all people can get bogged down by is why can it go wrong?
Yeah.
Then you spend an entire hour-long conversation defending yourself against what can go wrong.
That's exhausting.
Versus what can go right and what you have to make sure you get right. It's a subtle difference, right? It's still asking the same questions of like, you know, how about language? How about this? How about ethnicity? Things like that, right? But the framing makes all the difference in how people are perceiving this, right? And so I think it made a lot of sense for us to just, you know, take the plunge and move on over.
And how are you feeling about that potential move? Like, what are you excited about going to America?
I think I'm excited to get plugged into the ecosystem there. It's unparalleled in my experience so far. Every time I've gone to visit for work or for pleasure, on that note, it's been different. And I think it's what we need now to get to the next level of company. We need that ecosystem around us to sort of push past some of the initial barriers, I think.
Yeah, I totally agree with you because as a founder, getting rejected again and again, and people who just don't have that vision or don't want to help you in their vision, it's so tiresome.
Even founders themselves, right, in America, they gas you up.
Dude,
they're going to critique you, but they're going to gas you up in the end. Here,
it's like, really, are you doing that? Like, have you heard the Tom Blomfeld interview when he told people starting a bank in the UK
yes.
and they were like, what?
Indeed.
But in the US, people were like, oh my God, go, man.
Yeah, I mean,
do it.
Tom's completely right there.
Were there any unusual pieces of advice on your MedTech journey that really helped you propel your vision?
I don't know about specific advice because there was a flood of good advice. You know, nothing singularly life-changing, but lots of small bits of good advice, I think.
Yeah.
And again, you know, I don't want to disappoint because it's not specific to MedTech, really. I think one thing to realize is that in MedTech, as with everything else, but especially in a place where there's long sales cycle, where you need buy-in, where you're dealing with such sensitive things as patients and their health, relationships are everything, right? So getting people to understand that the benefit outweighs those risks requires trust. And the only way to build that trust is to actually build a relationship, right? Cold sales is really, really tough in this space. You want to make sure you can get to them and show them that you genuinely care. My 2 cents is that I think you should only be in this space if you have some form of a mission, because that's the only way you're going to get these people to want to work with you. It's going to get very down to business very quickly, but you need that sort of root level of trust to start talking about reimbursement dollars and savings, etc.
Funny enough, the last podcast we filmed, I don't know if you know Max Vitfayo, he said relationships.
Oh yeah, Max, I love Max.
I was like, what is the sort of top advice you'd have? He was like building relationships with people in the healthcare system because it's what's needed to get your vision. 100%.
Yeah. 100%. He's absolutely right. Conferences can be a waste of time if you don't know how to leverage them properly. And we're still learning on our side, right? But it really is about building relationships with not just the people in the system, but other founders, adjacent players who can give you the introductions properly. At the end of the day, if you're genuine about what you're trying to do and you have a good idea, people want to help you. But you need to show them that you care and that you're worth trusting.
So just being genuine and authentic and being a good person, like a nice person.
That's true. I mean, although, again, most advice that people give, it's context dependent, right? It's important to be genuine and authentic, but you're not going to tell an investor about all your hardships in your personal life, right? It does depend.
It's a balance. Well, thank you so much, Edwin. We have a next section of the podcast, and it is a cheeky quiz.
A quiz?
A cheeky MedTech mental health quiz.
Okay. Is it like rapid fire?
No. It doesn't have to be rapid fire. We can take it as slow as you want. Okay. So the first question, Edwin. What year was the term burnout officially recognized as a medical condition by the World Health Organization?
2011.
Wrong. No, I'm joking. No, yeah, it's wrong. It's 2019.
Good. I'm glad they actually recognize something. But
Yeah. What is the term for using smartphone sensors to passively collect data about a user's behavior to detect changes in mental health?
passive sensing data.
What the answer I have? It's called digital phenotyping.
Same buzzwords.
Same buzzwords, same difference.
thing.
Yeah.
Next question.
Next question,
ready.
please. You ready?
When did United which lost in the Premier League? 2013.
Won't be asking you any of those sorts of questions. Okay. Next question. True or false? Mixed anxiety and depression disorder is the most common mental health illness in the UK.
True.
You're correct.
This is it's actually a conversation like comorbidities, and I think people talk about that a lot, but they don't understand what it means. And I mean, it's really hard to sort of separate those two things,
Yeah.
right? Like, I think 85% of depression is comorbid with anxiety in the work that I did in my PhD. Like, when I looked
Really?
at the UK Biobank data, there was a huge overlap, which shouldn't be surprising. It's just, one feeds to the other, and they link to each other, both the mind and the brain.
Brain,
right?
yeah.
Anxiety itself is a comorbidity with many other conditions as well.
Researchers are exploring the use of gut microbiota to detect early signs of what mental health disorder?
Every one of them.
Well, says depression.
Yeah. I mean, I believe there must be research on the link between the gut-brain axis across different mental health disorder. So I'm going to challenge you and say you are wrong.
Okay, that's all right. Sometimes this happens on the podcast. People are like, can you fact check your questions? Like, I think CEOs, they get a bit defensive. As of 2023, which mental health app has the highest valuation globally?
Ooh, good question. It's either Calm or Headspace, surely.
Which one will you go for? If it's any one of them.
Yeah, it's one of those. It's Calm.
Correct!
there we
Yeah,
are.
let's end on a good note. Okay, so the next session of the podcast is called The Reality. This is where we spill the tea on all things being a CEO and running a startup. So what have been some of your biggest challenges running Psyrin?
Yeah, I feel like I'm going to repeat myself here with the MedTech stuff. I think the biggest challenge is probably the overthinking, right? I think as a CEO, you're always thinking about how do you make, the impossible a reality, right? I think one of my favorite quotes, I have no idea who said this, is just like the best CEOs, they can take the impossible, make it a reality, right? And I think that...
You're like quoting myself.
Maybe,
I'm kidding.
No, but but on many layers that's true, right? Like, it's both conceptually as a startup, we're trying to again change the way people interact with the concept of mental health. Change the way people think about what do I do when I'm feeling a bit sad? Like, what's the first thing I do? I want them to think, all right, Psyrin can help, right? That is making the impossible real, right? And I think that can very easily lead to a slide of overthinking, and especially if you're like myself, who thinks a lot, right? So that's one of the biggest challenges, to have good co-founders around you and a good team around you to keep you calm. I think we can take turns overthinking, but at the end of the day, we keep each other grounded and realize that you learn the most by, again, action, right? Bias to action. That's the main thing, right? You have to experiment and learn, fail, get rejected, get laughed at, get hate comments.
They've just started TikTok. Edwin was telling me about some of the hate comments.
You go through this stuff, don't you, until you realize things will be okay, right?
Yeah.
I think after a while, you start to feel comfortable in your skin and be like, yeah, I believe this. Maybe I'm wrong, but I think I'm right.
Yeah. And the next question is, what are some of the things, maybe knowing what you know now, what would you have done differently?
I struggle not to give the cliche answer of I wouldn't have done anything differently, right? Like, it's all learning, it's all habits for a reason, it's all the right thing. But like, incredibly tactically, right? Let's get real for a second. I would have done things differently, right? Or I would, in the next company, for example, do things differently. In that, if I were to pick the NHS, I would completely change my strategy around that. I think we spent up to a year, I would say, in the NHS market, or trying to get there, and completely fumbled the bag, right? It just wasn't the way you're supposed to do it. There's a good sort of tech ecosystem of influencers online. Like there's a guy named Liam Cahill. He writes a great blog on how to navigate the NHS, and I would have taken that advice on day one, learned from this advice.
Yeah. But that's the thing with entrepreneurship, is that people can give you advice, but unless you kind of do it yourself,
and I would have networked the hell out of the NHS much more, right? I would just not have started in the NHS in the first place, knowing what I know now, right, about the system itself. I understand the benefits of starting there. It's a smaller market, it's easier to get if you know people, but I mean, also there's the drawbacks as well, as I mentioned earlier in the podcast.
Yeah.
So that's one thing I might have done differently.
Brilliant. And sort of the final question is, what are kind of your working hours / your co-founders' working hours to get this impossible vision into a reality?
Extremely long. I can't put numbers on it, but one of the things that we value as a team is this sort of hardworking nature. I don't want to sit here and promote sort of toxic long hours for no good reason. But invariably, when you're building a startup, and imagine juggling that with a PhD at the time, you're going to be working all the time. You're going to have to make sacrifices. It's just the reality, right? It doesn't mean that you can't take care of yourself or take a break. In fact, the startup gives the flexibility to take a week off if you need it. You have co-founders to help you out, right? But There will be times where you're doing all-nighters back to back, including this weekend for myself.
All-nighters back to back.
Sometimes you have a deadline or you have to push something or something's going wrong, right? You need to be there because no one's waiting for you.
Brilliant. Well, to end the reality section, that is fantastic. So
Yes, reality indeed.
the final section of the podcast is going to be called The Future of Psyrin. So we're just going to explore your vision of the future, tell us what's happening next and elements like that. So yeah, what's next for Psyrin?
Well, I mean, the biggest thing on the horizon is the US. This is one of my last engagements in the UK before the team moves over to the United
So
States.
you've chosen to spend it on this podcast.
With Nova and Boba, yeah. It's just, you guys just have that reputation. I had to. Right? But moving to the US is the most immediate thing. As far as the company is concerned, we have about 10,000 spinning plates going on right now because we're pursuing every angle we can, right? So the biggest, most important thing for us right now is getting more valuable data. And I use those words carefully, right? I don't just want flimsy data from anywhere.
Yeah.
I want data that's labeled with quality and data that we can use to actually refine and train our models properly, right? What does that mean? Implementations in clinic, partnership with other startups, creative methods of collecting data from people, right? I think data is a huge focus of ours right now, whether it's through the academic context or the industrial context.
Fantastic. I know you've got some D2C element of Psyrin
Yes.
coming up. So I really want to delve into what the future of that looks like.
Basically, we thought to ourselves that with our vision of the world, where people access care immediately and they're empowered by things like biomarkers. So we decided to test that out by launching a sub-product, calling him Simon. Simon's a little bot, basically, that you speak with. And the Simon AI bot can then tell you whether you have these signs of neurodivergence. Right? It's a nice little starting point. It's not every mental illness at once, right? It's straining it to something that is understandable, relatable as a category. I think a lot of people are on the spectrum somewhere, right? And there's a good
On the
test for us
spectrum of what?
of neurodivergence,
Neurodivergent,
specifically,
okay.
right? So in both autism and ADHD are the classic examples. So we thought it made sense to try and understand how people interact with this tool. And also it serves as a nice little data flywheel for us to continually improve the algorithm, right? Simon listens to your voice and gives you some sort of probability score alongside the signs of the condition. Right? And what next after that? Well, Simon can help give you more support. You can sort of track over time how these markers in your voice of your neurodivergence change. So it's not just this person has ADHD, boom. It's this person has this type of ADHD because these features in their voice link to these particular symptoms, right? There's already been a movement looking at these conditions as a spectrum. It's in the term neurodiversity, right? It's diverse. But we've still been very constrained with labels. So we're trying to say, let's flip that script. We'll show you exactly what markers there are in your speech. And you can use that as literally, as the name suggests, a marker of how you're progressing over time.
Brilliant. And the final question is, what are you most excited for, Edwin?
The most excited for the superlative form of excitement. I don't think I have a singular thing, to be honest. A bit of a disappointing, deflating end, I guess. But
No, don't.
Everything is exciting, right? I think most immediately is the move to the United States. It's a big move, a big shift. But broadly speaking, I think it's hard to pick a single element of the startup journey that I'm most looking forward to. I think it's the whole experience itself. And again, this sounds so cheesy, but I'm grateful and lucky to be where I am right now. It's fun. I'm trying to change the world, make an impact, right? I feel like if you asked me about this 10 years ago, I would have bit your hand off. This would be the life I pick, right?
Wow.
So I'm looking forward to life, just generally. And I hope that we can make some good change.
Brilliant. And just to finally round off the podcast, what are the best things about running a business?
Ooh, the best things about running a business. I think on the real, what I love the most is that I no longer question purpose much. Does that make sense? I think in my PhD days or in my undergrad days, I spent a lot of time ruminating on what is the future?
Yeah.
What should I do with my life? Now, I don't have that anxiety or fear. I know what I'm doing with my life. I know why I'm doing this with my life. It's a real sense of who I am as a person. I think that is overwhelmingly the thing that I love the most about being in a startup and working with people in a startup. Working with people I love. My co-founders are great. My team is fantastic. We just hired a couple engineers. Phenomenal. Working with people you like is such a pleasure. Underrated as hell.
Brilliant. Thank you so much, Edwin. Do you have anything you just want to let out for the final time?
I think even if one person listens to this and decides to take the plunge and go for it, I'd be very happy. Do it. Do it. There's nothing to lose, right? So that's the last message I'd say. People are always asking, how do you do this? Why do you do it? Don't overthink it. Just try it. See what happens.
Brilliant. Well, thank you so much, Edwin. Wasn't he brilliant?
Clap it.